Mina Malik Hussain, and you're watching The Coffee Table, and we have such an amazing show today. I'm so excited. You know, I always am, but particularly more so because it is the beginning of March, and 8th of March is International Women's Day, as I'm sure you are all fully aware. The theme for this year's International Women's Day is Choose to Challenge, and all over the world, women and feminists and their allies march together in solidarity for the theme and for women's rights and for equality and for all the amazing work that activists all over the world do every single day to make the world a better place for everybody in it. The Aurat March is Pakistan's chapter, if you will, of International Women's Day, and in various cities across the country on the 8th of March, everybody marches together, again, in solidarity with our brothers and sisters, our comrades, really, all over the world. And today, joining me are two volunteers for the Aurat March, the Lahore chapter, and we are going to talk about the manifesto for Aurat March this year for Pakistan, which is focused on women and their access to healthcare. So we're going to sort of have a conversation about what it means to have equal access to healthcare for women and the various challenges that women face when it comes to their physical their physical well-being. So joining me today on the show and on set, super exciting, is Fatima Razzaq, who is a journalist at Sujag. She is also a gender rights activist and, as I said, a volunteer for Aurat March Lahore. And joining me also is Fatima Shahid, who is an activist and social worker who uses her literature and her art to garner solidarity and spark interesting conversations amongst people. Welcome to the show, both Fatimas.
Thank you so much for having us.
Yes, after a very long-winded introduction.
Thank you for that.
No, I'm so excited. And first of all, may I say, like, congratulations and thank you for all your hard work organizing.
In fact, it is actually very nice doing this. In fact, whenever March comes, we just feel like it's our time. It is like finally women are going to come out. It's our time to be visible everywhere. So this celebration's on.
Quite right. And I just find it so heartening that it's a global movement.
It definitely is.
Yeah, everybody is in it together, like all of its allies are in it together, and it's just so much good energy and so much, I think, good intentions, and I think a lot of people are very nervous also because of it. But that's another conversation.
Of course.
So Fatma, tell me a little bit more about the manifesto for this year, for us.
Right. So this year's Aurat March Lahore has a theme every year. And we basically, so there are many things that we want to talk about from a feminist lens, let's say. And we think a lot of conversations are not even viewed from a feminist perspective. Healthcare is one of them. If you look at healthcare, we don't know what are the problems that women in specific are facing. For example, we always talk about it in a very holistic manner, always brushing the 50% population of women under the carpet and just talking about it in a very vague sense. We think there's a massive need to talk about healthcare from a feminist lens, and that is what our manifesto is about. It's a very comprehensive, 32-page long document, and we always try to shorten it up for people. But it's very, we did massive research, talked to stakeholders like communities, minority communities, Christian women, Hindu women. We learned about their issues specific to healthcare, their access to healthcare, sanitary workers, how are polio workers, lady health workers accessing health, how are they treated when they go around distributing healthcare to every, you could say, street and nook of Pakistan and every corner of the country. So their problems, and also about the doctors, about the female doctors, and not just that then, the women in general as well. Are they able to access healthcare or not? How are they treated? How many menstrual health is still a taboo? A lot of these things need to be talked about, and I think Fatima can probably tell us more more about summarize the manifesto for us, and then we can just go on discussing. This is one topic which can never end.
That is never going to end because it's the vast one. So basically, we're going to start it from like children. Right. So
that's really interesting, I think, to interrupt right at the beginning.
That's okay.
Is because a lot of times when we think about feminist manifestos, or we think about sort of healthcare, a lot of time we think about women and we think about adults. But it's actually really important to remember that healthcare and access to healthcare is a sort of pyramid where it begins with the kids.
Start from the children. Yeah, so basically
especially girl children.
Yeah. That is the precious thing about Aurat March. It doesn't only talk about the women, it talks about the transgenders, the non-binary community, and every community that is present in Pakistan. So the first demand that we put in a manifesto, I know it's 36 pages long, you guys gonna be like, we're not gonna read that, but you know, it's like a months and months research of ours. So a lot more hard work is put into it. So we would want you guys to read that. So the first one is like, you know, we demand a consent-based education system in the primary and secondary education. So that the student, the children, and the adults would be knowing that, you know, you have an autonomy over your body and you have to insert that right. And by this point, by this demand, it's going to be that way that there would be a reduced number of child abuse then.
Yes, because again, healthcare also basically means looking after your body, and consent is a very important part of that.
And
so for you to be aware of what is okay and what is not okay.
Yeah, because it doesn't have to be like if your family member is doing that, you have to stay quiet. You have to talk about that. If you talk about that, other people are going to talk about that too. And this way, you would know that you have to, you know, there would be a difference of what's right and what's wrong, what's consent and what's not done with consent. So that's going to be a really good thing.
And it's important because this is a matter of protecting children and protecting their bodily autonomy, which is a huge part of health, isn't it? Because then I suppose it also informs their mental health as well.
Exactly.
Like, you don't want trauma being inflicted on children if you can avoid it or you can do something to prevent it.
That is one of our demands too. We want some rehabilitation centers to be exhibited in a really good way, that all the abuse survivors, the victims, they should be treated in a really good manner. Their later lives should not be wasted that way from the trauma of their past.
And to recognize that survivors need support in order to live a healthy life. A global problem, because I feel like a lot of the things in the Aurat March manifesto are actually echoing issues that are global issues. And all around the world, consent, for example, is a conversation that is happening. And all around the world, women's access to healthcare is a problem for everybody. It's not just us.
So even like throughout the world, even people are now marching. Women are taking to streets in the entire, and we're seeing results as well. In most of Latin America, women have marched out and they've gotten their rights. They've gotten some laws to change, and we've also seen that. Because of these conversations starting, we've seen the banning of two-finger tests in Pakistan, in Punjab specifically. So you can't say that marching out for your rights or coming out on the streets is basically useless, or women should not be doing that. We've seen the change coming. We've seen some progress coming, and we've seen like conversations like these on media making some change happen.
So Fatima, tell me, and I think this is something that people again don't really consider that much, but can you explain how is it a form of violence to deny a woman access to healthcare or medical attention?
Right. So we need to understand one thing, right? That is, women's health care is something that directly impacts their bodies. And if you're harming a body, that means that you're basically perpetrating violence on that person. So a lot of women, when they go through childbirth, maternal mortality, so that means that a lot of women die. You're basically allowing women to be killed in the process, as simple or as natural as giving childbirth. So similarly for menstrual health as well, women drop out or girl education rates are very less. This is something that's talked about very globally as well. Everyone wants to fix the gender balance in Pakistan.
And we want more girls in school, and we are committed to having, you know, girls having a quality education.
Of course.
But you can't do that without acknowledging and understanding that the requirements for girls to be in school are different from boys. They're just physically different.
So, I mean, like New Zealand has right now, they just announced that they're going to give free menstrual hygiene products for free, exactly. Many girls drop out of school because of that. The other thing in our manifesto is about healthcare and about the budget allocated to health, and we want that it should be increased to 5% at least.
Because again, like you mentioned, a lot of women are unable to go to hospitals to access healthcare because the hospitals don't exist. They might have people in their families who wanted to take them, but then where could you go? I think the nearest hospital was in the nearest city, which was like
exactly
2 hours away.
And COVID, I think like this pandemic basically laid bare the crisis, the healthcare crisis that we have right now.
You had to get a blood test if you were pregnant or if you had a deficiency or something. You wouldn't know, and you would, just for simple blood test, you would have to travel a long way.
Of course.
And then the travel is also, you are dependent on somebody to go with you or take you, and complex.
We are basically adding barriers in every step. If you are lucky enough to find safe transport, then you have to travel many kilometers to access a doctor. When you go there, you either don't have many female doctors present there, or
they're also a barrier for a lot of households.
Exactly. And then when you're trying to access healthcare there, the kind of treatment that women face, and this is very important, I think.
Right. And I'm going to interrupt you here because we're going to take a break on a note of suspense. Stay with us. This is a fabulous and fascinating conversation. Much to learn. We'll be back in a minute. Welcome back to the coffee table. We're having such an interesting and layered conversation with journalist and gender rights activist Fatima Razzaq, and activist and social worker Fatima Shahid, who are also both volunteers for the Aurat March Lahore. And we are talking about how important it is for women to have access to healthcare in Pakistan and all around the world. So one aspect of healthcare and access to it is this idea of the access being universal. So Fatima, could you sort of tell me, what does that imply, that a universal healthcare?
Basically, universal healthcare means that, when Aurat March comes, people are going to be like, it's all about feminism. And that means they're going to be like, you hate men. I'm sorry that your vocabulary is so big for that, the specific word, and that is called misandry. We don't hate men. We're not going to suppress them. We're not going to oppress them. That is the beauty of Aurat March, that it doesn't only involve women. Again, I said that. All the non-binary communities, transgenders, even then men too, who are the victims, who are the survivors, we're there with them too.
Absolutely.
So the universal healthcare means that we are not going to eliminate the men. We are going to talk about them too. So these are some things that, if, this should be the accessibility to all kind of human nature, that are creation that are in this world.
Quite right. And that's the advantage of looking at things through a feminist lens also. Because I feel like a lot of times people think that when you are looking at something from a feminist view, it means that it's just for women. But it's important to kind of remind people that it's not. Feminism is for everybody, because the patriarchy is bad for everybody. It oppresses everyone.
Exactly.
And yes,
not equally, but it does.
It does. It definitely does. And I think, like, again, men are victims of patriarchy as well. But in universal healthcare, another important thing is that throughout the world, we see that healthcare is more accessible to people who can afford it. And there are many programs going on where you want that the people who cannot afford to get a very costly test done, or to afford a very hefty money where healthcare, where you have to give thousands of rupees just to access a doctor every time, or pay their fee. Universal means that it should be accessible to even the people who cannot afford it. Specifically to women and to children, because their malnutrition is rampant. They're not able to access hygiene products. They're not able to access medicines the same way that other people are able to. So we need to facilitate them as well. We need to start making it more universal, more accessible, cheaper specifically, so that people can just afford the price of healthcare in Pakistan.
And for example, like in the Punjab, there is a really great schedule of vaccinations that the government provides for free. And on the coffee table, we talk to so many medical professionals who talk about how prevention is so effective that if you are able to get that done, you are saving kids' lives. So they're not dying of things like typhoid or dysentery, which shouldn't be happening in this day and age. And there, of course, so many countries have so many challenges, but if we can kind of get ahead of them in some ways, that would be amazing.
Yeah, whenever we're comparing with different countries, we never talk about how we can actually take a lead in many ways. And we are ahead in many ways when it comes to many countries. So fair enough, let's take our women better. In Pakistan, we have 50% of the population is women.
And it's also that connection, isn't it, where let's say malnutrition leads to weaker adults, which leads to women giving birth to babies that are underweight, who then grow up to be malnourished adults. So it becomes a kind of really terrible cycle, and fixing that cycle or treating illness,
that requires intervention. That requires intervention from the part of the government, that requires an intervention from the part of the medical profession as well. And that is why a feminist lens and talking about is important. If they don't realize the kind of problems that women face. So, for example, a lot of women in Pakistan are, and again, like across the world as well, a lot of women are not allowed to practice. Many women doctors leave the profession because they're not allowed to be doctors or to continue practice after marriage. That needs to be broken down. That means that we don't have enough doctors who are available to people for access to healthcare.
And like we talked about before the break, it is a barrier to many women seeking medical help if they can't access a female doctor.
Of course.
These are all these sort of strands that are sort of really coming together. It's really complex, isn't it? So Fatima, could you also now tell me what are the kind of common ways that sort of represent or things that happen, like when we say women are denied access to healthcare, what does that look like? Like what happens when you are unable to receive medical attention?
Okay, so basically, it's like, women are considered the most sensitive creatures, and they're the most, soft-hearted creation when it comes to their children. So it's going to be like, they're always going to compromise things, even if it's their health. In the, you can say in the basic class of lifestyle, there it's going to be that way that women are going to compromise over their health for some financial cases too, right? For some family creations too, because they're going to be like, why? Are you sure? Are you sure? Like you're not doing good? Like, dude, if she's saying she's not doing good, she's definitely not doing good. You have to respect her with that.
Like a lot of times people don't take it seriously either. And that whole idea, that it's a sort of hysterical woman that maybe, you're trying to do this for attention. It's like, oh, my head is hurting, and everyone's like, okay, it's hurting.
And even doctors don't take women seriously as well.
That's true.
Many doctors would just be very inconsiderate to women and when it comes to their problems. So not prescribing painkillers, not prescribing multivitamins or something, because they think that you can manage. And women, on the other hand, they're taught to sacrifice much more. A woman would sacrifice her food for the food of her children, would never, her meal is mostly the last in the house, because again, they're so bothered and they're so, you could say, like caught up with feeding the children, taking care of the house, doing laundry, going to grocery, everything else is on a woman's mind except for her own self. So that means that they're not prioritizing themselves, and we've seen that happen to our mothers, we've seen that happen to people in our society, and it's very common throughout the world. Self-care is a very alien concept to women.
That's true, and it's almost sort of seen as a selfish thing that, and maybe it's this whole kind of disregard for your own body comes from years of internalizing this idea that women should be selfless. But selfless doesn't mean self-neglectful either.
Exactly.
And again, sort of I'm thinking about the shows that we do for breast cancer, and oncologists have told us that a lot of women have lumps, but they don't report it because they're uncomfortable with their own body. It's awkward for them to talk about their own body in those terms. And B, again, it's not a matter of priority. Something else is always somehow more important. And you also feel like, well, I don't want to sort of put that attention on.
And what's the sad part? Like in Pakistan, every 1 out of 10 women have the breast cancer, right?
That's a huge statistic.
It's the 6th number in the whole world to have the breast cancer.
Yeah. So again, women's access to healthcare, we're not talking about things in a vacuum.
Of course.
This is like a ground reality. And like you said, like our moms do this. I find myself doing it. I have kids and I'm just like, okay, I'll go later.
Exactly.
And then later never happens.
Exactly.
So again, the social constructs that we have, the attitudes that we have towards women, and the internalized misogyny that women also have, where we never care about ourselves. We're never that vigilant. So if my child has fever, I would take him to the doctor like within 10 seconds.
Yeah, you drop everything and just do it.
And but even in the pandemic, we've seen many women just waiting for the fever to end on its own because they're like, okay, that's too much of a problem, too much of a hassle. And similarly, I think another problem that we have that is about the lady health workers. So
now we're sort of coming to the care economy, as it were, because there's so many people who form this whole kind of ecosystem of healthcare. So we're not just talking about patients, we're talking about the providers and practitioners and professionals who also are sort of on the ground doing all of this. Very important. So yes, lady health workers.
So there's one very nice slogan that I really like, and we're trying to incorporate it in our march as well. A beautiful poster that said that I care about everyone and I go door to door. I'm explaining it more basically. So I go door to door providing healthcare, but who's looking after me? There's literally no one. Thousands of healthcare providers are going in every village in Pakistan.
And again, this is a community thing then, because we can't just sort of say that, oh, it's your problem or it's your problem. It's everybody's problem.
It's everybody's problem.
Because somebody like a lady health worker is the backbone of this sort of, I think, the health network, because, polio drops they're administering. They're sort of helping with census work. It's not just, one thing. They're advising so many households on safe practices for kids.
They're the link between the government. They're the link. Government makes the policies. Who implements them? Who goes door to door? Creating awareness about, let's say, reproductive health, about birth control and everything else. So these are the women who matter, but they're the most ignored as well. So
Fatima, do you feel like denial of healthcare is also a social problem in the sense that a lot of families don't prioritize women's health because ultimately women are not really seen as that important?
Yeah, obviously. And when we went for the medical camps, we did it in basically in the transgenders community, because in our country, transgenders are not even considered as human beings. They're not even provided with even this minor,
let alone male or female.
Yeah, exactly. And then it's something like, again, women are gonna fight for other women, then who's gonna fight for the women? Like, we're going to go door to door, but who's going to come to us and ask if we're doing okay, if we're healthy, if we're being treated in a really good way? There's no one to ask for us. So at the end, they're going to be like, it's just like women and women together we're going to change the world, inshallah.
Yes, we will. We're going to take a very quick break and come back to this really important conversation. Stay with us. Welcome back to the coffee table and this magnificently layered conversation about women's rights and their access to healthcare and why this is such an important global issue. And we've been talking to journalist and gender rights activist Fatima Razzaq and activist and social worker Fatima Shahid all about it. So Fatima, this one, this Fatima, tell me, I was also reading about this, and it's part of the manifesto also includes sort of really examining why the privatization of the healthcare sector is also an issue that we need to be thinking about really carefully. But why?
Yeah, basically the stigma that we have added in the manifesto is that we want that healthcare sector to be given an increase of 5% of GDP, right? And that would result into not privatizing this thing, and why is it getting privatized? Because from 2017 to 18, from 1.2 to 2018 and 19, 1.1% has been decreased. That is resulting in the privatization of the healthcare sector.
Because so what we're saying is that because there isn't enough money being put into the healthcare sector, there is a gap. And that gap is being addressed by the private sector, who then obviously they to sort of provide the healthcare that the government is struggling to provide.
But then the problem.
But then why is that bad? Like, why is that a problem?
Yeah, the problem is because it raises the cost. It becomes way more expensive.
Yeah.
That means that, again, universal healthcare falls flat. And throughout the world, if you see health insurances or healthcare programs are being introduced for the same reason, right? Because you have single mothers, you have women, your economy right now throughout the world has taken a dip. Because of the pandemic, people are not able to earn a lot, definitely. So how are they going to afford a medicine that costs 1,000 a month or 1,000 a week when they're earning 100 a week, right?
Yeah.
So it becomes a problem then. We need, for universal healthcare to exist, we need subsidized healthcare. For subsidized healthcare, we need the government to put in the money in healthcare as well. Otherwise, how are people going to earn? They're just going to be massive profits made by the private healthcare companies, by the pharmaceutical companies, by everyone else, but not any cheap or accessible healthcare available to.
And that sort of goes back to what we were talking about before also, is that only the government is in a position to make hospitals or even health clinics in little villages and far-flung areas, because they're the ones with those kind of resources. Like a profit-making organization wouldn't do that because it wouldn't make any sense for them to do it. Like they have no incentive.
Exactly.
That is why throughout the world, basic facilities like health, education, clothing, shelter, housing. These are basic facilities without which you cannot survive. So we cannot say that, oh, let's ignore that. Let's spend more on other things. They are important, but this is for your survival.
Absolutely.
If more people are dying, if more people are falling to the pandemic, if more people are contracting COVID, if more people are dying while giving childbirth, then that means that there's something wrong. There's something wrong that we're doing when it comes to allocation of resources.
And it's also interesting to me to read about how not having access to contraception or having your access denied to contraception is also a form of violence. And I guess this sort of goes back to bodily autonomy, doesn't it?
And that's huge. Like 3.7 million women have unplanned pregnancies. And when they have unplanned pregnancies, they don't know what to do with them. Their body is not ready for them. Their body is not ready to take on a pregnancy. Then there are high chances of miscarriage, high chances of the child being born, unborn children. So these are the problems. Again, as you said, it's a cycle then. It's an adult, it's a child who's malnutritioned or unfortunately with any other physical or mental disability, and then the child becomes an unhealthy adult and the cycle goes on. And similarly with contraceptives, again, and pregnancies, if you're talking about them, early marriages are another cause of, you can say, very early pregnancies. When the child or the girl child is not able to conceive, and when she conceives at a very early age, the pregnancy is very risky then.
It's very risky, and this happens, and because this is a global problem, I know that I've read statistics with the WHO about this, about how early marriages can lead to all sorts of complications, not just for mums, but like secondary sterility or having really low birth weight children who are more susceptible to not surviving their first 2 or 3 years. So it's not a thing that happens in a vacuum.
All of these are linked at the end of the day. Early marriages are again coming out of a social construct. They're coming out of a household where the only burden on a woman is her marriage and not her education. We're not letting our children or our women to get higher education. Instead, we're sending them off to be married. That means that the only thing a woman should be used for is marriage and giving birth.
That's reducing the value of a woman's contribution. But then this is also, I feel like, and again, I sort of like jumping from here and there, but there's like so many things. It's all connected. It's all this sort of, this wheel.
Feminists around the world have been doing that.
Yeah.
We cannot talk about healthcare and not talk about environment. We cannot talk about healthcare and not talk about COVID, vaccines, everything. And economy as well, the care economy, the economy that is not giving us enough money to put in our healthcare. So
Fatima, I feel like we can't talk about women in healthcare without talking about reproductive health. And a huge chunk of that is menstrual health. And again, globally, like I feel like these are conversations that when we don't have, a lot of people are really unaware of how half of humanity is coping with a great deal of pain and discomfort and distress, because not everybody has what is called a healthy period.
Exactly. So in Pakistan, that 79% of women are not given a proper hygienic period time. And why is that so? Because there is a thing like honor that is related with haya, and people here not really talk about that thing. And if like
people are embarrassed and
exactly
sort of feel conscious talking about
exactly. So if there are a variety of girls during their immunity, some are really weak with that, they can't really bear that pain, and when they go for the colleges off, they're gonna be questioned that why are you taking off? That should be like that should be again questioned again. So this thing is something that it's understandable. They should be given some time. They should be given some accessibility. And then if we look at the worldwide globe, it's something that it's not like people are talking about that thing now.
Yes.
If we go for New Zealand, they have done that thing, providing free sanitary napkins. So it's something that people are talking about that. And if they are talking about that, we have to talk about that too. So we're trying to put that thing in our card too, in our manifesto card, that we want the free accessibility to the sanitary napkins, so that women would have a bit of safe and healthy periods in the future.
And hygienic as well, because then you're, like you said, you're sort of prone to more, prone to disease and prone to infection. That is a preventable thing.
Exactly.
I think like the emphasis for me is like it's preventable. There are solutions around this. But do you also feel, Fatima, that, for example, going to a gynecologist, for example, is also seen as something that only married people are allowed to do. And that's also really problematic, because that's not true. Like, you don't have to just be married to see a gynecologist. There's so many issues that one can face.
So, for example, irregular periods, endometriosis, polycystic ovaries, right? So many women, hormonal issues. So not every woman's period is on the clock. Many women have delayed. Many women, because of malnutrition or any just like eating changes, there are differences, and they need to seek the help of a doctor in the end. Why is it a taboo to just go to a doctor just because it's a gynecologist and the doctor delivers babies? So you cannot go to a doctor if you're not pregnant. That doesn't make sense. But that's happening. That's rampant in Pakistan and around the world as well. So
and even inside the doctor's clinic, there's also like a sort of gap there also, where there are a lot of really intrusive questions asked by nurses taking your history. Are you married? Are you not? What's the scene? And the thing is that why should you have to disclose all of these details, and you should just have kind of unjudgmental access?
Because it's your right. Again, we don't demand it as a right. Right now, we've been just requesting it that please listen to us, and not saying that if you don't listen to us, it's our right. It's every human's right to be able to access a doctor and be given medical health. So we can't really do that without it. And similarly, in a lot of medicines that are prescribed too by the doctors, we see there's a massive gap. We call this like gender pain gap as well. So again, in terms of
gender pain gap.
Pain gap.
Wow, what is that?
Gender pain gap is basically the idea that many women experience pain when it comes to the healthcare in many fields, but that's disregarded. That's neither invested into in terms of money, that's neither listened to by the doctors. There's a lack of empathy, and moreover that, very interestingly, there's a massive lack of research when it comes to understanding women's bodies as well. So can you believe, like, for example, medicines that are equally applicable on women, diabetes, or let's say hypertension, or blood pressure controlling
which
medicines.
is an ungendered problem.
Ungendered problem, right? But the research and the testing, most of it is done on men. So we know, what works for a male body. But wait, where are the women? Women are also diabetic. Women are also can
have
experience
heart trouble or
heart diseases,
kidney problems,
everything.
So it's a problem because we don't have enough research to show the effect of certain medications on a woman's physiology.
Exactly.
Chemistry.
If you remember, like similarly,
and that's important because women's bodies and hormones and things are not the same as men's, so they will metabolize medication differently.
Yeah. A very simplistic or a funny example, but just like, many African Americans in the world have been asking for beauty products that suit their skin tone.
Absolutely.
Similarly, many of them are also asking for medicines that, suit their population as well.
Yes.
And similarly, many women and feminists around the world are asking the medical researchers, the scientists, the people who are testing vaccines even to include women, to make it more representative across the board and not just take the men and
as the universal standard.
As the universal standard, yes.
Which is clearly not the case. And I think that this also, we come back to contraception also, where a lot of birth control is for women to take.
Yeah.
And a lot of times it doesn't suit women and it's not an effective way, but there isn't enough research happening to address that as well. And I think this is also where the vaccination for HPV is also relevant.
That's for the cervix cancer. Basically, it's really common in women.
Yes.
And again, it's going to relate it to the women's private parts. So people are not going to talk a lot about that, right? Yeah. So we demand that thing too, that the cervix screening should be a part of the national immunization system, so that every woman should be accessible to this thing and they should be favored with this unless they, face some really bad things in the future regarding their health. So again, it's a major thing that is related to the women's health.
Yeah, and again, it's a preventable thing because if you can vaccinate it for HPV
vaccine,
which is the virus that eventually does cause cervical cancer. And again, it's just a specifically women thing.
Exactly,
like,
but yeah.
You have to have a cervix to
One thing
get
too.
it.
Basically, in Pakistan, it is provided, but again, it's privately provided, and then when it's something privately, it's gonna be, unaffordable.
Yes.
Exactly.
Yes. So access is again not universal then.
Yes.
That is so great. This is a conversation that I think I could just keep on talking about. Thank you so much for taking out the time to kind of unpack a lot of the major issues that the manifesto includes. And it's important to remember that this is not just a Pakistan-specific thing. These are issues that women all over the world face. It is a global conversation that we are a part of in a very significant way, and I think that's something to be really proud of. The march is on the 8th of March. We march in March. It would be wonderful if you read up and educated yourself about the manifesto for the Aurat March this year, about International Women's Day, general global theme, and what it is to be an ally, because when we are all safe, then the world is better for all of us, for women and kids and for men. And, why shouldn't we live in a better world or leave something behind for our kids that they can be proud of? If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on The Coffee Table. Bye now.